Welcome to the show. I'm Kathy Ireland. Hospice organizations provide compassionate and palliative care for millions of American patients and their families. Grant Fabian, president of Wise Hospice Options, joins us today to explain how his company is helping hospice organizations streamline their operations to provide better patient care. Welcome, Grant.
Hey, thanks. Very good to be here.
Grant, could you explain your pharmacy program and how it is specifically designed for hospice care?
Well, sure. First, just a little background on what hospice is. Hospice is part of Medicare. About 90% of the patients on hospice are Medicare recipients. Our average age is around, 77 years old. So what happens is part of Medicare Part A. In Medicare Part A, we have the Medicare Part D that came out in the early 2000s and was passed by Congress, and that was to cover the drug benefit for patients on Medicare. Well, in this case, Part A, hospice is part of Part A, but hospice has to cover all of the medications related to the terminal prognosis. So in this case, what we do is the hospice utilizes a service such as us to help them manage their pharmacy benefit. They have to pay for those drugs. There's no Medicare D plan, it's in A. And so we come alongside hospice and help them through purchasing a network of pharmacies. We have clinical pharmacists that work with the clinicians on staff available 24/7 to help with any complex issues that patients may have. And so we're really trying to bend that cost curve, help hospices keep their costs in line. They are under a what's called a per diem, so they get about $150, $160 a day for each patient, and that's what they get. And they have to provide all of these services. And so understanding that, not just the nursing, but the drugs, the durable medical equipment, the supplies, the chaplains, the social workers that help them do advanced directives, all of these things are part of the hospice benefit. And so out of that money, they've got a budget, and they can't, if they go over that, they lose money. And there's no turning back. And of course, then there's all sorts of regulatory issues and trying to make sure that stays. So we really try to help hospices within the three tiers of expense outside of patient care, but it's in pharmacy and in durable medical equipment and then in purchasing of medical supplies, and try to help them manage those budgets.
So for the past 15 years, I've been the lead physician at Capital Caring, and one of our primary responsibilities is to make sure that we have safe and effective, high-quality medications available to people with an advanced illness so that we can make sure they're as comfortable as possible. Wise Hospice Options has been, for about 7 years, our pharmacy benefit manager at Capital Caring. We went through a vigorous RFP, request for proposals, process a number of years ago as we were using a different provider, and ultimately selected Wise Hospice Options and have stuck with them for 7 years because of the terrific partnership that we have with them and the value that they deliver to both Capital Caring and, most importantly, to the patients and families that we care for. Which basically means that we work with Wise Hospice Options as a partner to connect Capital Caring with all of the local pharmacies throughout the DC, Maryland, and Virginia area, so that when we, as Capital Caring physicians, prescribe a medication, those pharmacies know who we are, know how to process the claims, and ultimately work through Wise Hospice Options to make sure that Capital Caring pays appropriately the pharmacy for the medicines that are dispensed for our Capital Caring patients.
Wise Hospice Options has been a great supporter of not-for-profit and community-based hospices for many years. They're an innovative company that provide innovative ways for pharmacy and DME solutions for many of our programs. They're now moving into the space of doing patient identification through a partnership with Acclivity, which many of our providers are also doing. They support NPHI through helping us think through some of the regulatory issues that surround pharmacy and DME, and also through being a great partner for things like our annual summit, where they will support us, and also through helping us gain access to ideas and innovations in the pharmacy and DME space in which they work so closely.
Grant, what is the vision for Wise Hospice Options?
Well, we're really excited. The vision is as I talked about the silver tsunami, all of the baby boomers turning 75. This is revolutionary. I mean, it was revolutionary in the 60s, the late 60s, it's revolutionary now. And so I don't think people realize the budget, the Medicare budget, and how that's, I don't think we really get a handle on why we're spending $1 trillion deficits. And a lot of it is related to health care. I see our opportunity to help. It's going to be hard to reduce costs with that many people coming on, but I think we can put people in the right places, and we can save money in certain aspects and provide a better level of care than we've ever provided before. So our vision is to be part of that. This machine learning is just really exciting because we believe we can get people who have the greatest need. We believe we can get them in the right place. It's terrible to have your mom or dad, you didn't think they were going to die, and they die a week later, and you could not prepare. You couldn't think about it, when they're in the ICU, and it's a terrible tragedy. Or they get on a hospice and they're on 2 days, and there's no time for the social worker to do their work, to get the advanced directives, to get, everything lined up, the affairs in order. So it's really exciting for us to see us being able to give people the opportunity to get on this beforehand, help the family, and really, in a sense, it will bend the cost curve down.
Well, Grant, it sounds like Wise Hospice Options is giving companies the tools that they need to streamline their businesses and to better serve their patients. Congratulations to you, and thank you for joining us.
Sure, thanks, Kathy.
Thank you. Thank you for watching. I'm Kathy Ireland.